Okay, welcome guys. Thanks for joining me today on today's podcast episode. I'm joined as always by the lovely Elle McFeeters, Student Association President. How are you doing today, Elle?
I'm doing well, thanks. How are you, Leighton?
Good, thanks. And we have a very special guest today, Catherine Hollington. Thanks for joining us today, the campus healthcare working nurse. How are
Oh,
you today?
thank you. No, we're fine. Thank you for inviting us because a lot of the students didn't realize that we're still operational, but in a different way.
Yeah. So that's a great kind of prelude into what we're going to talk about today. Would you mind kind of just explaining to our viewers how your office is running right now and why are you guys still open when the rest of the schools is kind of closed for access?
Thank you for that question because as everybody knew, middle of March, big changes came into everybody's life with COVID-19 and closures happened to keep everybody safe and protected. As we are in the business of St. Lawrence College, we were originally closed with the campus because we are also protected with everybody else that's in the college. But it was soon recognized that shouldn't have been the case. And so with the support of everybody here at the college, we quickly kind of reorganized and scrambled, just like all the students had to figure out a new method of delivery for healthcare, because we were trying to, protect everybody, including myself, the registered nurse here, and Dr. Simpson, who are the only two healthcare providers on campus. It's just her and myself, and we're figuring out how to do telemedicine. With the great team and support of everybody of SLC's IT department and such. So we transitioned from in-house visits, as was recommended by the Ontario Public Health, to do telemedicine, and that's what we're doing. It took about about 8 business days for us to get our act together, and unfortunately, a lot of students didn't realize that we did reopen, so that was it's been kind of a slow go, but that's going to be our model moving forward until other notice from the regional public health unit.
Okay, that's great. So what would the process for a student who would need support look like to get from you guys?
That is, so right now, all of our information on how we can get contacted is on the St. Lawrence College website under the COVID tab. So for anybody that misses any of my information, if they want to quickly get that access, it's on the St. Lawrence College main page under the COVID-19, what services are available. So what it will tell you that basically you call ahead. We do not have walk-in appointments. Of course, the whole campus is locked. Every door is locked. Anybody that is offered an appointment in the clinic is I screen them very diligently before we consider it one of those essential visits. But all they need to do is call the campus health center at our normal phone number, which is also listed on the St. Lawrence College website, to talk with me, and we book a telemedicine appointment, which is what we're doing right now from telemedicine, because there's different electronic devices that could be used for telemedicine. Currently, we're doing phone. We're working towards virtual application through Teams. We just have to make sure that it's going to remain secure and private under a regulation mandate. But right now it's phone, and we're open to take those Monday through Friday, 8 to 4. We're open, and Dr. Simpson talks to the students on the phone, whomever needs it, for prescription, for illness even, but we're available.
That's good. So how busy are you guys right now, considering everything that's going on?
Well, we had compiled in that 7 to 8 business days while we were trying to figure out what we were going to do. Dr. Simpson and myself, compiled some of the ongoing patient clients that needed ongoing care quickly, so that we could reach out to them. A lot of prescription renewals that need to be refilled. With COVID-19, pharmacies are restricting the number of prescription releases that they're doing because of supply and demand concerns. So a lot of our patients will be running out of their prescriptions sooner than later. So we're having a lot of prescription renewals. We're available as our counselors in student wellness, which I should also mention, in terms of being available to help our students through any concerns mental health wise or academically as well. But we're also we're addressing a lot of students who are having a hard time adjusting to this quick changeover and this sense of uncertainty in our environment. So quite a bit of mental health support as well. That's primarily what we're doing right now in terms of busyness. And we're averaging a good number of students a day. I'm booking them as we would a normal doctor's office, and charts are pulled and prepared. Dr. Simpson and I are reviewing the charts before we see or speak to the student. So we're well prepared ahead of time so that we can ask the right questions. It is a little different when you're not in front of a student or a patient when you're doing an assessment. So our questions are a little bit longer and the appointment times are a bit longer as well, just so that we can capture everything we need in order to provide the best care.
Great, that's awesome. So you mentioned the counselors. Would students contact the same way? Like, would they contact the health center to get connected with the counselor if they don't already have one?
How they would access their most definitely can come through the campus health center if they need to, but they have their own direct line, and that is also on the St. Lawrence College website under the COVID tab to find out what services are available. They are accessible. We have the same number of counselors that are there to help support the students through their mental health, there's situational struggles, but that's how they would do it as well. They would follow, if they've already been connected with a counselor before the shutdown, they would have access to that counselor's email, and that would be a point of contact. If it's a new student who hasn't used our facility or service yet, then they can find all that information on the St. Lawrence College webpage.
Okay, that's great.
Good. So, Catherine, are you in contact with any friends or coworkers down at the hospital or Hotel Jew or anything? What's kind of the mood or kind of the atmosphere that your friends and coworkers might be feeling right now?
Well, we're coming from different sectors, Leighton, so we all have the same sense of responsibility and how to protect everybody that we want to care for. We do it differently in different sectors. So from Mars is a primary care provider. It's a little bit different than what they're doing down in a hospital where people will walk in with potential symptoms or what have you. We're in a private sector, like in a primary care sector, we're able to do all those screenings and not necessarily put ourselves at as much harm's way as our other frontline workers. So as nurses, and I think in general health providers, we go to work whether there's a crisis like COVID or not. And I think what we have that's collaborative between all of us, regardless of where we're working, whether primary care or in hospital, is that we want to do the best we can for our patients and be accessible. And then that means that we have to do things differently by making sure that we stay healthy so that we can come to work to continue looking after those people. So I think that's the mood that everybody is on, and I hope they go home just as I do and rejuvenate. Very tiring because we do use our PPE here between the staff, like even Dr. Simpson and I do, between the two of us, to make sure that we keep each other healthy, because we do need to come to work and look after our students. I would have to say I would think that people are starting to get tired of wearing the PPE, and it takes a lot more steps just to get the normal job done, and have to redefine and refine our assessment skills because we're doing it through so many barriers that can be tiring. So I think that might be a common mood or infliction that this whole crisis is having on the healthcare sector.
Mm-hmm.
Yeah, absolutely. And it seems to kind of be the feeling amongst at least my family and friends. People are kind of getting tired of this, but it's just important to remember we're not through this yet. And to hear that echoed by healthcare professionals, I think carries a lot more weight than people on Facebook or social media. All that kind of stuff, right?
It's very, very true. We are getting tired, but we are also getting very optimistic when we listen to our regional public health unit and the governments, and we're hearing on CBC News and from reliable sources that things are looking more optimistic, but that's because we're doing everything right. We're following what the guidelines are doing. We're listening to public health and all those media outreaches to continue with the physical distancing, staying home if you need to, and that is the most important thing we need to be doing, despite that kind of elevated mood a little bit, to think, oh, maybe there's a light at the end of the tunnel, and there certainly is. We have a lot of people that are working really hard towards that goal, but from our students' point of view, it's really important to continue what we're doing by staying at home, staying safe, the physical distancing. It's very important to continue that.
For sure. I definitely agree. So with that being said, what is your perspective on some of the newer announcements that are coming out with some of the lifts for like retail establishments and different businesses and things like that?
Again, I'll just reiterate what the Public Health of Ontario are saying when they make these decisions. I follow what they say with regards to, even though they might be lifting some of the restrictions, that the reason they're doing that is because things are a bit more optimistic. But it can revert back to the original situation if we're not careful with following the guidelines of hand washing, physical distancing, staying home. All those decisions to lift restrictions are not saying that we stop doing what we're doing. It's if we keep doing that, then those restrictions can stay off. It's very important that people realize that we're still in the midst of this. It's not gone away. It's going to be a long time before it's gone away. So we have to be very careful to keep ourselves and everyone we love and care for safe by following the Public Health of Ontario's guidelines.
Yeah, Catherine, continuing on that, would you be able to maybe share some of those guidelines with us? I know there's maybe a little bit of gray area out there. Are things such as having a friend over for a beer in the backyard, are those kind of things allowed? I mean, what would you say are people able to do to kind of help alleviate this while maintaining these guidelines?
So again, I reference everybody right back to our regional public health unit, which is the KFL&A public health unit. They have a wonderful, informative site that talks all about those really gray areas about what's essential, what's not essential. And I think that if anybody is wondering what they can and cannot do, that they should go and read it for themselves, because as most messages, as we know, we hear from people on podcasts or on the CBC News or anything, it's always open to interpretation. So my recommendation and what I do and what I say to people that come in my circle through my patients is I let them know that there is a reliable resource out there. It's KFL&A Public Health Unit, and a lot of the other regional public health units as well, whether it's Toronto or Ottawa or the government of Canada. They really, really answer those questions as, can I have my friend over for a beer? Well, go back and look at the resources, read what they're saying, because you don't know where that friend has been or who they've been in contact with. There's a risk factor in that. Has that friend been outside of Kingston, or are they healthcare providers? Are they as serious about maintaining physical distancing and staying home and staying safe? So there's a lot of resource out there that a student, one of our lovely students, can actually go and make that decision on their own with the resources that are available through the Regional Public Health Unit here in Kingston, which is KFL&A Public Health Unit.
Mm-hmm.
Yeah, thank you for that. I think it's important to remember, and what I'll just kind of summarize here is, even though there may not be many cases here in Kingston, as you said, we're not anywhere near close to this being over. So it is important to refer to those guidelines, and I'm glad that you kind of mentioned that. So Catherine, do you probably aren't dealing with any COVID-19 patients at the college, but my question for you, are you still feeling adequately, protected? Do you guys have all the information and equipment that you guys need to to handle something like that in case somebody who was infected was to come into the health center, or would that just be an immediate send them down to kind of KGH type of thing, a patient?
Well, great question. So our community has done a really great job in publicizing what the signs and symptoms are. The Ontario government put out that self-assessment tool way back a couple of weeks ago for students and population, but we're talking about our students, can actually go and do their self-assessment so that they would avoid even attempting to come into hospitals or into their family doctor's offices, which are all closed down. Our testing center is here in Kingston at the Memorial Center, which is downtown on York Street. From that point of view, sorry, Leighton, I got a little sidetracked there. But in terms of what we see here, or what we don't see here, I think that because our community has done such a great job, and the messaging through our online programs, like our online website here through St. Lawrence College, and all the media in Kingston, I think what ends up happening is a lot of our students, if they were concerned, they would go right down to that testing center and have those that assessment done there. I hope I answered that. Sorry about that.
No, it was good. I do believe as well, I think it's the KFL&A Health Center that you would call if you think that you might have symptoms as well, like rather than calling your doctor or a walk-in clinic, that kind of stuff. If you feel like you have symptoms, you would first call them. So
it happens, yes, Al. So all of our healthcare providers in Kingston have included in their voice message system all those steps to take, including the one that we have here at the Campus Health Center. It is lengthy. Unfortunately, everybody trying to get a hold of their health provider has to listen to all the same directive. But I mimic what the KFL&A Public Health Unit has suggested that we stay on our phone message system, as with others, is where to go if you're concerned with the illness, who to call, such as Telehealth Ontario if it's after hours, where to go to get tested during hours, how to contact Regional Public Health Unit. All that information is on our telephone message system. And as you mentioned, Elle, KFL&A Public Health Unit has also a phone line that isn't as informative. It's great, it has all that same information, but their website has a great information, everything you need to know in terms of what's here regionally.
Okay, that's great. That's good to know for students for sure.
Yeah. So Catherine, in our pre-interview, we kind of talked about maybe sharing some things with students, some tips, some tricks to kind of remain healthy during this time. What would you say would maybe be some of your biggest pieces of advice to kind of get students to get into a proper hygiene routine right now?
So I'm very pleased to be able to offer that, because that is the one area that now that school is over and exams are done, and for most of our students anyway, I know we do have the spring and summer semesters and students are still struggling, but it is hard that once that distraction is gone, is what do you do with your time? And that can cause a lot of stress and a lot of mental health and issues and a lot of isolation. So number one, what Dr. Simpson and I have been reiterating a lot is to try and stay in a good routine. Try not to interrupt your sleep pattern when there's very little demand on you because of school being done, and of course nothing outside that's open that can keep you interactive. It's very easy for people to slip into not getting out of their pajamas, not eating properly, not going outside, sleeping when you're getting bored or have nothing else to do. But in times like this, it's really important to try and keep those habits and those routines in place. Get up, eat your breakfast, get out of your jammies, get outside, get some fresh air. I mean, yes, the conservatory areas are now open for people to walk through, minding the social distancing. So to get outside, to get some fresh air, get some daylight. See people when you're walking with the social distancing, recognizing there are other people out there. When we talk about hygiene, I think that is the most important thing to focus on, is to get up, shower, get out of your jammies, get outside, get some sun, try and keep that routine going, because it's a very stressful time, this big scramble and the isolation and not being able to see our family and our friends, because of, you know, respecting safety can cause a lot of sense of isolation, and make people really sad. So getting outside and moving your body and getting that fresh air and getting that exercise will keep the mood higher and keep the spirits up as well.
Yeah, so it sounds like mental health is just as important as physical health in kind of combating this as a group, as a people. How have you and your family kind of been dealing with this and coping? Any kind of issues there?
Well, I'm sure as same as yourself, Al, and Leighton and everybody else. We've been, you know, been strictly isolating. I have my family unit that live under the same roof, and we have been dealing with each other. I have to say I'm very happy to come to work every day. Not to mention because I love what I do and I want to be here and be accessible to the students, but also because I think my kid and my husband would be driving me nuts. We're doing the best thing we can do as well. I mean, when I leave the house, I suggest my daughter do some extra cooking and my husband to go into the workshop. It's not easy. We talk about it. And every now and again, like everybody else, we start thinking, you know, oh, maybe we'll just go and do this, you know, and then we look at each other and we think, no, remember. So no, it's been hard for that's the same as everybody else. Isolation has been very difficult. When Dr. Simpson and I come in to the college, it's very quiet. There's nobody here. There's only one door that the student could actually come into if there is an actual in-house appointment that's required. So it's isolating. It's sad. It's not what we're used to. We're very social. Humans are social. We like to be around our friends, and it's been hard. But I think the means of electronic devices, I think, has helped quite a bit. Where you can do some FaceTiming and the Teams meeting and such and see people. So I'm really grateful for that. But no, it's hard for me as it is for everybody. I think people need to know that everybody is feeling the same thing.
Yeah, for sure. I can definitely echo, I mean, the majority of what you said. If I didn't stick to my routine, I would probably be going crazy. Like you said, I would just be sleeping. So that's been really helpful. And being in a full house with other people is just, at first it was nice. Like we all played board games and did everything like that. But now we're all kind of getting to the point where we're almost sick of each other.
Yes.
So we'll all just kind of go on walks by ourselves, or just, kind of even distance a little bit and then come together when we're all like in a good mood.
Exactly.
And, FaceTiming all my friends definitely helps.
And I think it's a good thing, Al, that you brought up as well, similar to my own household, is it's all right to give yourself permission to say, I can't be around this person anymore now. And to communicate about it, because if you're living in a household that's larger than yourself and one partner, tensions can rise and irritations can develop. So I think it's important that communication in this kind of situation is important to keep those relationships strong, and to give each other permission to say, okay, I need a timeout. I'm just gonna go to my room now before I say something. To recognize that is very normal, very human.
Yeah, for sure. And like you said too, we're all in this together, right? Like everyone is going through the same thing, so it's not like you're on your own.
That's right.
Mm-hmm.
Yeah, for sure. Well, Catherine, is there any kind of sense of frustration amongst you and your coworkers from, I guess, the general perception in the public that this is it's being seen as more of an inconvenience right now? And I hate to use that word because it's a global pandemic, but what is the general feeling of the nursing body, I guess, towards that sentiment of the public? Is it just kind of frustration, or is there understanding there?
I can't speak for a lot of the frontline workers, because it's like I said before, where I am is very different than what my colleagues would be dealing with in an emergency room or an urgent care setting. From my point of view, I'm not frustrated. I guess I could say I could get frustrated if I find people aren't, you know, or if people are becoming a little less diligent or becoming complacent with the, you know, the social distancing and maintaining that, you know, strict safety. I guess that would be what I would be frustrated with. But from my point of view, I think that from outside of frustrations, I think people are just getting tired. Like, I don't think that it's I don't think it's anything but just, you know, maybe feeling tired. You know, that would be it. I think that from my point of view, I listen to what's being broadcasted, you know, from our PM when Prime Minister Trudeau does his announcements, and I hear all the help he's giving people, and you know, I think our governments are really engaged with the public, and I get optimism when I listen to that. I think the healthcare sector as well, but I have to say, I can't comment on what it's like going into work and not having enough PPE. That's not my environment. I'm very protected here, where we have our supplies. I have the support from everybody at St. Lawrence College, so I can't really speak to my colleagues. But I would imagine going into work wondering whether you have enough PPE or you have the right support would be more than frustrating. It would be more scary than frustrating.
Yeah, absolutely. And as we kind of get into May here and the nicer weather, there was maybe some comments by the Premier that things could be open up by the May long weekend. I guess my final question for you is, what kind of, I guess, advice would you kind of impart on our viewers to kind of just get through these next couple of months?
Well, again, I'd go right back to, you know, following the guidelines, listening to reliable sources with regards to what is true and what is not true. It's really easy to glean what you want to hear out of messages and then adjust your behaviors accordingly. I think that it's very important to stay true to the guidelines that have been dictated to us, or, you know, expressed to us by our regional public health unit and the government of Canada as an overall messaging system, to really stick to what they're saying. May 2-4 weekend, I mean, I can imagine myself thinking, oh, would you think being around people? But honestly, again, it's physical distancing, the number of people per the group. I know there's a lot of talk about that, but really, I think what I would recommend and before engaging in anything outside of what you've been doing with COVID-19 is revisit those resources through the Regional Public Health Unit, KFL&A, to see if there's been any changes in approach and behavior, because any diversions from that, any movement from what we were doing can bring us right back to square one. So, and the best place to know whether or not that's a possibility by our behavior is going to our Regional Public Health Unit. They update that every 24 hours.
Awesome. Well, I'll be sure to put some of those links that you mentioned at the bottom of our YouTube video here, so that we can share that with our viewers and our students. But I guess that kind of covers everything I was hoping to talk about today. Elle, did you have any final questions?
No, I just want to say, like, really appreciate you coming on the podcast today and sharing all of the knowledge and information that you have with our students, because I know a lot of people are still kind of in the unsure zone. We always share those resources and things like that, so we'll continue to do so. And yeah, thank you very much.
Oh, that's great. So, yep, I guess the best resource, like I mentioned, Leighton, is the KFL&A Public Health Unit for our community approach, and anything that the students require from support point of view is right on our website. And of course, Glenn Valkenbreg, of course, puts out his news feeds too, and just encourage the students to keep an ear out to what's happening through our college communications and through our regional public health unit.
Awesome. Well, thank you both for your time today. Really appreciate it. And Catherine, our sincere gratitude to you and the rest of the first responders and frontline healthcare workers. Thank you for your time today.
Thank you very much. Have a good weekend.
You too.
Okay.
Okay,
Take care.
bye.
Bye.